Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Directory Communications and MC here at Gold Learning. Well, welcome everyone. I'm so delighted to have Alyssa Schnell with us here today, talking about her presentation coming up at Gold Learning and Gold Lactation, From Challenges to Success: How to Choose and Use Nursing Supplementers in Lactation Support. Well, welcome back, Alyssa. It's so great to have you here at Gold.
Oh, thank you, Fiona. I'm so glad to be here.
What a great topic. And I have a little bit of an inside scoop because because your presentation is one of our dedicated packages this year. Of course, I got to listen to your presentation today, which just brings me so much joy. It actually, for our viewers listening in, I will do a little bit of a brag of Alyssa because she really is so dedicated in this area, so much knowledge, and it feels like you always take things to a whole new level. So thank you for that. Thank you for always knowing how to bring it so successfully to all of our professionals here at Gold.
Oh, thank you. It really relates to my passion of working with induced lactation as an adoptive mom myself, feeling, gosh, 19 years ago when she arrived, not having a lot of information and support. And I don't want it to be like that anymore. I want there to be tons of information and support for all the parents who are breastfeeding in all the various unique circumstances.
Right. And I guess that's really where supplementers come in because for some people, they might still see it as this distant, perhaps therapy. It's interesting. I still find that in the field, Alyssa, and of course, I know you're working with families, but I find that a lot of professionals are still not opting to go down this route in terms of care and management. I find that often bottles have been introduced prior, to coming in and because of the problems that they've been having. Is this still something that you see in yourself as well? Like, you're like, oh, I wish, this could have been resolved sooner, because you shared some of those stats with us today, when it comes to using a supplementer and how it intersperses with breastfeeding as well as bottle feeding. Tell me a little bit about your experience right now working with families and professionals alike.
Yeah, one thing that I found really helpful is sort of the gradual introduction to the idea of using a nursing supplementer. So some situations where it might be easiest to do that would be, well, in my situation, I'm working with induced lactation. We already know before baby arrives that there's a pretty high chance of supplementation needed. But we also may work with birthing parents where we know before baby arrives that there's going to be a pretty good chance that supplementation may be needed, either because there was lower milk production with a previous baby, breast reduction surgery, indications of IGT. So in those cases, that's probably the ideal scenario because before baby
Right,
arrives, we can introduce this idea, which is very foreign to most people. They've seen bottles, they know you can supplement with bottles, but this other thing
right.
is seems very strange, maybe even medical. Um, so I always encourage parents, if they know that there's a chance they may need to supplement, talk to them about the various different devices, the different brands or a homemade or whatever they might want to choose, help them look at the pros and cons. And then before baby arrives, get it. Get the supplementer, practice with it, fill it with water, take it apart, put it together, have the partner practice with it, even have the partner suckle the parent at the breast with the nursing supplementer filled with water. Anything that they can do to familiarize themselves with it can make that easier. The other thing that could be really helpful is peers. Having
Mm.
somebody that they know who successfully used a nursing supplementer. And if that's not available, well, then we have photos and videos of other parents so they can actually see it being used in a successful way. And so that once they actually are using it themselves, it doesn't feel so foreign.
Yeah, you're absolutely right. It sometimes it's sort of that foreign entity, but it's what people have gotten used to. People have gotten used to just, perhaps introducing a bottle, or perhaps that's what they were advised to do early on because the professional they were working with, or perhaps it was even in the hospital, becomes somewhat easier. Can we talk about that language a little bit? Because I hear that quite a bit. Is it in fact easier? What attributes to easier when it comes to these types of management and care? Is it short term easier to just give a bottle? Is that not true at all? Is it easier to use some type of supplementer? Because they're not all alike. That's the other
Mhm.
thing. When we talk about supplementer, there are many different types of supplementation, correct?
Right. Oh, you mean at supplementing at breast? Is that what you're saying?
Yeah.
Yeah, versus
Yeah.
there's a lot of alternatives to bottle feeding, not just the nursing supplementer for sure. I guess even though I'm a huge, huge fan of the nursing supplementer,
Right.
it's not easier than bottles probably at the very beginning. Um, Although in the long term, that's going to be increasing your breastfeeding success. And there's that,
Right.
we know all those kind of risks of introducing bottles early on. So if there's a if there's a support and the interest of using a nursing supplementer, that's going to improve the long-term ease, even if it doesn't support the short-term ease. I guess in some ways it's kind of like the decision between breastfeeding and bottle feeding. Yeah, probably from the very beginning, bottles are easier, but in the long
Right.
term, breastfeeding is going to be way easier.
Yes, that is true. Yeah, that's something I've always considered to be a bit of a mantra for me because I know too that it is a bit of an investment, but it, I think a lot of the time when I'm working with clients today, everybody wants that solution right away. We're sort of fixated on quick fixes and so forth and so on. But given an opportunity to counsel families who are, I guess this goes back to finding out what people's individual goals are and
Mhm.
what they are looking sort of long term. Because, like you said, if you're, well, supplementation of the breast and or a supplemental feeder, then you're looking at the outcomes being really good in terms of, choosing that route. So tell me, how is the research looking right now, Alyssa, in terms of, supplementation and or a supplementer at the breast? I know supplementer is your one of your favorites, but tell me a little bit about the research.
There was one research study that was looking at introduction of bottles versus using a nursing supplementer, and the long-term breastfeeding rates were decreased with the introduction of a bottle, where they were
Mm,
not decreased with the introduction of the supplementer.
yeah, and is that recent? Is that recent research that's available, or is this something that was done a while ago?
I think it was from 2017.
That's not bad,
Yeah,
that's
not
that's
too
not
bad.
bad at all. Yeah.
Yeah, it was from person, I can't remember her first name. The last name was Penny, but she did a whole dissertation on nursing supplementers. So
Oh,
she has
fabulous.
several or published studies
Sure.
on using it. Yeah.
Yeah, yeah, that's really exciting because I think that's something that, is helpful. So when it comes to professionals, we really want to educate them, and that's what this presentation, of course, will really help with as well. But there's some extended, education you're teaching professionals as well right now, correct, Alyssa?
Oh, yes. So I offer a couple of things for professionals, online resources. One is the Breastfeeding Without Birthing Professional Pack. That's an
Hmm.
online supplement to my book, Breastfeeding Without Birthing. It does definitely talk about the nursing supplementer because that's, a big part oftentimes of inducing lactation. In fact, so much of what I do in the book, Breastfeeding Without Birthing, and the professional pack is applicable to any situation when there's difficulties with milk
Love that.
production, especially, long-term difficulties with milk production. In some
Yeah,
ways, it's really not that different. Maybe
right.
the biggest difference is for a birthing parent, oftentimes is surprised when they have trouble making enough milk. For those who non-birthing parents, they expect it from the very beginning.
Right.
So
Yeah.
but other than how, but the logistics of how we can support them is very much the same. And then
Yeah.
the other thing that I offer is Dom Hub, which is an online research source for domperidone. It really came out of, for those of us in the United States, domperidone is not a government-approved medication, yet is
Right.
very commonly used.
Right.
And that is kind of a scary piece that people are using a medication without adequate supervision and
Support. Yeah.
information. And some un- not good things have happened from
Mm.
that.
Yeah.
And so I put this out as a way of providing as much information, research based, it's all research based, about domperidone, how to use it safely, effectively, what are the contraindications, what are the medications that are contraindicated, how to dose appropriately, how to discontinue appropriately, so that parents can use it in a very safe way. And then for those of us who cannot get it from our pharmacies, there are links of places to order them that have been reputable, because not all
Right.
of them are. Yeah.
Right. No, and that's really important. That's an amazing resource, and very much appreciated. Yeah, the sort of ongoing trials and tribulations of, supporting families, that might need that medication and or not, again, having the resources because we know there's some factors now about, being safe when you're taking it and when you're coming off of it, because that
Mhm.
was one of the things that came out too. So thank you so much for that. Alyssa, it is always so great to talk to you, about this topic, what you're doing. And again, for those of you who are tuning in today, Alyssa's going to be with us for our Gold Lactation Online Conference this year, talking about from challenges to success. That's what we all want, how to choose and use nursing supplementers in lactation support. Thank you again, Alyssa, for being with us here today.
Thank you so much. My pleasure.
And thank you to all our friends listening in. We'll look forward to seeing you online. You can head over to the website right now to goldlactation.com to get all the details about this presentation and all the others coming up this year for 2025. Thank you again for joining us here today and have a wonderful rest of your day. Bye bye for now, everyone.